My name is Chelsea Burrows, and I have been a CPS investigator in King County for 5 years in June. And I'm testifying today in my capacity as a WFSE member in support of Senate Bill 6109. Between 2017 and 2022, the number of dependency petitions filed in Washington declined by over 50%. And between July 1st and December 1st, 2023, we saw approximately 23% fewer children coming into care, with the largest reduction being in children ages 0 to 3. But at the same time, we're seeing a large increase in fentanyl-related critical incidents, primarily in children ages 0 to 2. Last May, I investigated the near-fatal overdose of a 7-week-old. His parents were upfront and honest with the department about their fentanyl use and reported they were willing to engage in services. We gave them what we consider to be our harm reduction kit, which includes a lockbox, fentanyl test strips, and Narcan. The primary caregiving parent was engaged in outpatient treatment and providing UAs. They completed intensive family preservation services, with the only recommendation being that the parent should go to inpatient treatment, which they were not willing to do. The family lived in a community-based housing with a case manager, public health nurse, and support from peers. The department utilized a safety plan that included daily check-ins from family members and professional parties, including the public health nurse. The family voluntary services worker also met with the family at their home 1 to 2 times each week. And in fact, she was at their home just hours before the overdose occurred. It was only after the 7-pound, 7-week-old overdose and required 2 adult doses of Narcan, the department was able to seek out-of-home care, because the messaging that we received consistently is that if parents are doing services, we simply do not have sufficient reason to file, even if those services are not enough to keep a child safe. And unfortunately, my example is not an outlier. A parent's willingness and even participation in services does not automatically make a child safe. And providing education to the court about what services are available and what those services entail will help the court better understand both the opportunities and the limitations of those services as they relate to child safety. Senate Bill 6109 recognizes the lethality of fentanyl and accurately prioritizes immediate child safety while continuing to expand the pathways and services that will support families in the long term. And I urge you to support this bill. Thank you.